In 2021, an anonymous tip led KXAN investigators to discover hundreds of medical debt lawsuits piling up in one Central Texas court, filed on behalf of one local hospital. While its collection methods were legal, what's most important to convey was the impact they had on patients, a revelation in our reporting that led to a new state law. In a From the Vault edition of Inside the Investigation, our team takes a look at its medical debt lawsuits project and where the story could go from here.
Hello and welcome to another edition of Inside the Investigation, a From the Vault edition. I am Josh Hinkle, the Director of Investigations and Innovation, here with my colleague, Arezow, Doost, an investigative reporter with our team. Thanks for being with us.
Thanks for having me.
So today on From the Vault, we're talking about a past catalyst project called Medical Debt Lawsuits. Remember this one?
I had to go back and dig deep and try to figure out where we ended up with it.
I haven't forgotten this one because this was one of our more challenging stories to get out there because there were so many pieces to it. So if you're not familiar with our project, back in 2021, we started getting all of these emails and then looking up lawsuits that were being filed and playing out in Justice of the Peace courts in Williamson County, just north of Boston. They were all talking about one hospital in Williamson County that was suing hundreds of patients for non-payment for things like medical debt. And we thought that was kind of strange because we hadn't ever seen anything to that level. Of course, you see medical debt lawsuits pop up from time to time when you're checking courts and when you're kind of going through lawsuits, but not to this level. And what was really interesting was that this was the time of the COVID-19 pandemic. So this was all playing out while many patients were already financially strapped, many of them sick, worrying about getting out and about, being at hospitals. And so we wanted to figure out what was really happening. Was this an anomaly and was happening on a bigger scale? One of the things you had to do was go to those Justice of the Peace courts, in person. We couldn't take cameras in, but you saw something there and it led us to knowing that this was a much bigger project.
Sitting through those hearings, first of all, the courtroom was packed every time you went when this was on the docket. And honestly, a lot of times it was families who were just showing up because they didn't know what else to do. And though most of the cases were centered around this one hospital, what we learned quickly was there were other cases, other hospitals, people who were even dealing with smaller clinics who were all of a sudden getting calls from debt collectors or bills. And they had no idea, what is this bill for? I won't ever forget, we came across one family who'd never even been to the hospital. At the time, they were so hesitant to even share any information with us because that's how scared they were. But hearing these cases, there were similarities. Everyone getting these bills, no one having an idea or sense of where these invoices were coming from, the charges, services they were even for.
Yeah, and this was happening all around the nation, but to specifically hone in on the storytelling that was happening in our own backyard, we did a crowdsourcing campaign. Essentially, we took all of those lawsuits, those hundreds of lawsuits, and we sent out written letters, handwritten letters, and we got several responses back from people. Basically, we explained to them, we noticed this was happening. This seemed unusual to us. We would like to talk to you about your situation. And we're going to be following up with the hospital and looking into this story further. With the responses we got back, we heard from and interviewed a mother who had gone through cancer treatment during this time. We heard from a single mother who was having medical bills that were piling up because of some things that her children had to go to the hospital for. It was individual stories like that, but the common thread was that many of the patients had never or thought that they had never received a bill in the first place. So it was kind of a surprise when the first thing that they remember happening was ending up in court, being sued by this hospital. Now, the hospital was telling them in communications at that point, we will settle for a higher amount if you'll pay this, but if not, we're taking you to court. And that's what we did see. So to really understand if this was a bigger problem across Texas and the nation, we partnered with someone that I had met through Investigative Reporters and Editors, the organization that many of us belong to as investigative journalists, named Jeannie Pender. And Jeannie was someone who was a New York-based journalist who ran a nonprofit called Clear Health Costs. That's really kind of a media outlet that researches things like this, not just medical debt, but many things that are happening in the healthcare marketplace. And what she told us was, yes, this is happening and I'd love to partner with you. So we partnered with Clear Health Costs for this story and continued crowdsourcing and putting together a digital docuseries, several on-air stories. We did an immersive web site that you can see at kxan.com/medical-debt. We also put out a podcast that features an episode with Jeannie. So she kind of explains what's happening across the industry. But some of the biggest things started happening after the initial launch of the project. We kept following this during the legislative session that happened in 2023, I believe. Yes. It seems like they're all kind of bleeding together. But because this was happening in Williamson County, we reached out to the Williamson County House Representative to see if she was aware of this and if they might do something to help prevent surprise billing like this. What did you find out?
The most interesting thing was this had been tried to be remedied past sessions. We're talking about years ago. And right after our investigation, we learned that Representative Caroline Harris Davila was really trying to push for transparency. Her office continues today to hear complaints about this. And so in 2023, her law went into effect. And essentially, it requires hospitals and healthcare providers to provide an itemized billing to patients before it goes to debt collection, and also make that bill in terms that you and I, any patient, would understand. And further, it took another step to make sure it's provided either electronically or through a patient portal. Representative Harris Davila said that she wanted this to be a central issue during that session, and it was, because she was able to pass it. And she tasked the Texas Health and Human Services Commission to not only oversee it, the rollout, but also monitor compliance. I just connected with her to see, what are you thinking? How did all of this go for you? And she said, surprisingly, the few complaints that have gone to the agency, HHSC, they've been remedied so quickly that there's been no enforcement action that's been needed. But still, this is something that she's monitoring, to the point where last session, she actually made an adjustment to the law. She was hearing that some people didn't have internet access, or they didn't have the means to figure out how to start a patient portal. So the addition of the law makes it to where if a patient does not have access to the internet, that hospital group, healthcare provider must figure out a way to get them that itemized bill in another way. So through U.S. mail.
Of course, they will continue following up on the law to make sure there's different aspects that are working or not working. One of the big complaints or concerns that we heard when it was kind of going through the initial stages with the committee process was from the industry, like the Texas Hospital Association. They were worried that this was going to cost their hospitals and be very time consuming. So far, we haven't really heard about that thing, but we will continue monitoring that.
And we've repeatedly asked the Texas Hospital Association, how are things going? And they keep saying, we had to figure it out. We figured it out. Our hospitals are working hard to be in compliance. And in fact, Representative Harris Davila said she's thinking ahead to next session in January to see what else needs to be done. For instance, she wants to make sure that there is a time period for these bills before they go to debt collectors. So she's thinking about legislation where there would be an actual, hey, you have to wait 60 days before you send anything to debt collectors. So we need to be definitely watching to see what she does next with it. We do know that transparency has been an issue with other lawmakers too. In fact, just a few days ago, you shared with me that HHSC shared with lawmakers that hospitals have to at least post somewhere, right, what their services are going to cost. And so for the last several years, that has been monitored, and there has been some compliance issues. So lawmakers will be watching that too.
Well, we will continue following up on this as well. We love it when our work is able to help spark legislation like this. And our promise to our viewers is that we will continue following that, because it may not be perfect the first time around, and lawmakers often continue building on legislation session after session after session. This is definitely one to watch, though. This project won a National Edward R. Murrow Award for Excellence in Innovation. So we really have to thank our digital team for working with us on that. Robert Sims helped creating the site. Kate Winkle really helping us kind of go through all the bells and whistles. That podcast, the digital docuseries I mentioned, we'll put links all on this story online. But for now, Thank you for being with me,
Thank you.
and thanks for watching.
You can watch all new episodes of Inside the Investigation on the KXAN Plus Smart TV app every Friday. You can also listen to an audio version on KXAN's Investigative podcast with new episodes every Saturday morning wherever you get podcasts.